can't afford to pay, and they don't have insurance. The clinic's mission is basically the purpose of St. Luke Community Clinic is to provide basic health services so as to improve the health of the residents of Warren County who are medically uninsured and do not have resources for health care. The clinic started 13 years ago. It was started by a group of concerned citizens who recognized that the problem of the uninsured existed. And this is going back 13 years. This is not a new problem. It has been around for a long time. And this group of concerned citizens, made up of doctors, nurses, a clergy person, decided that they wanted to do something to help their community. So they incorporated, became a 501c3 nonprofit organization, and opened a wholly volunteer clinic. The clinic met once a month in the basement of a local church, and what was organized with nurses and physicians and screening folks to come together and serve our community. We had hoped 13 years ago that this would be a temporary need, but unfortunately, instead of being a temporary need, we still exist. And instead of once a month clinic, we're now open 4 days a week with a walk-in evening clinic every week, and we are well used. Last year, we saw a total of 1,246. That's an unduplicated number. We gave thousands of visits to people. We do this by small staff and by volunteers. We're blessed with volunteers. We receive a lot of support from Warren Memorial Hospital and from Valley Health. We have support in the community. And what we're trying to do is reach out and assist those that can't afford to pay for their care. So this is not a new problem. Furthermore, what we learned in the clinic is that statistics are wonderful, but they're only numbers. For the clinic, the statistics have faces, names, families, stories. We see them in the supermarket. We see these folks on the street, in traffic. We see them. They are our neighbors. So with this group of people that started the clinic, and the board and the volunteers and the staff that continue it do this because this is our way of supporting the uninsured and helping and creating a healthier community. So this is where St. Luke has come from. Now the free clinic is not only other communities have free clinics. We have St. Luke, but there are at least 54 other free clinics across the state. There are probably more, but I know there are 54 members of the Virginia Association of Free Clinics. So it's not just a Warren County issue. It is a Virginia-wide issue. We have a limited budget. We do what we can. It's not the total answer. Do we meet everybody's need? No. Even with the help of our healthcare partners, we can't meet everybody's need. There are not enough dollars or personnel to go around. But we try.
Thank you, Joan. Our next person on our panel, again, is Kathleen Cartier. She's a nurse. She has her MSN, and currently she's the Director of Education at Warren Memorial Hospital. So she has a lot of insight internationally, too. So, Kathleen?
Good afternoon. I'm here today mainly as a member of the Virginia Nurses Association, which is a part of the American Nurses Association. The ANA represents all 2.9 million United States nurses. It has continued to advocate for healthcare reform since 1991, when with 60 other nursing and other organizations, they endorsed a joint statement to seek comprehensive reform along with incremental improvements in quality, cost, and access. And in February of this year, they revised their statement to include workforce issues to reflect the continuing shortage of nurses. I've been a registered nurse for 32 years, and for 22 of those years, I worked in neonatal intensive care with premature and sick infants. Some were born as early as 24 weeks into the mother's pregnancy, and a normal expectancy is 40 weeks. I've seen incredible miracles as our technology has improved. But despite these advances and the fact that we're #1 in healthcare spending, the CDC lists the U.S. as 45th in worldwide infant mortality rates, well behind Canada, which is 36th, and Great Britain, which is 32nd. This number is important because that's the number that is generally used to reflect the overall health of a country. As mentioned before, in 2002, I was very privileged to be Valley Health's first representative in a very novel program of international exchange with St. Bart's and the Royal London National Health Service Trust. National Health Service Trust just means that's their form of health care, and trust is kind of like the hospital facility. During my nearly 4 weeks there, I began to learn about their system of health care and worked alongside their NICU staff. I observed the same tiny infants being saved and cared for with similar levels of technology and equipment, and I went over there knowing the stories that we hear that care is rationed. Through their visiting nurses program, all children are followed in their homes for the first 5 years of life to ensure that they have a great foundation for a long and healthy life. Through this program, I met wonderful friends and colleagues that I've kept in touch with, and they frequently come to the States for holiday. One of them recently broke their ankle while they were here and sought care in a local emergency room. They were just astounded at how much paperwork and cost of their care. This was completely foreign to them. I'm also a healthcare consumer. I'm fortunate that through my various full-time positions at Valley Health, my family has been provided healthcare coverage. Employees' portion over the last 15 years that I've been with Winchester Medical Center and now with Warren County has increased, but I'm paid well and it's not been a big problem for me. I worry about those people who are at lower levels in our healthcare system, if they can afford it. We're also allowed to voluntarily enroll in a flexible spending account where money is taken out pre-tax and put aside for reimbursement from things like our co-pays and out-of-pocket expenses. But to reclaim this money takes time to submit explanation of benefits to our benefits department. I've used it for many years, but recently I had to take 2 days off just to deal with all that paperwork. So that's just one example of the paperwork we're drowning in, and that's, again, the increased cost of administration, costs and clerical work as well. And lastly, as part of the system, I see failures every day in our community, such as a young woman who is a diabetic, so we know her through St. Luke's and through the diabetic program that we work with. She's working 2 jobs in order to support 2 children on her own, and she was hospitalized in a very serious condition because she had to make a choice between where to spend her scarce dollars, and she chose not to use those dollars for her life-saving insulin and was admitted to the hospital in critical condition. We have to do better than this. Thank you.
Thank you, Kathleen. And next we have Dr. Charles Heber. He's an internist. He's practiced in Front Royal for over 31 years. He was a clinical professor of medicine, and he is now on the board of directors at Warren Memorial Hospital. And I'm sure you have a lot to tell us.
Well, thank you very much, Ms. Katz. I want to spend some time talking with you about several aspects of our healthcare system and some of its deficiencies, particularly discrepancies in the system and inefficiencies, and look at some of the comparison with our other industrialized nations. There's been some reference to them already. I'd like to take a moment then to look at the lack of what happens when we have this lack of access to medical care, hence lack of insurance, how it actually causes increased cost for our health care for everyone in the United States. And lastly, spend a moment talking to you about the role of primary care in our health care delivery system and how very important it is and how much we may need to invest in it and how much in our cost savings there will be with further improvement in our primary care system. Just some comments about the disparities in our healthcare system. The lack of adequate healthcare insurance and accessibility can lead or does lead to an increase in the number of preventable hospitalizations for patients with chronic care.